Welcome to Healthy Care, where we share practical tips for keeping your little one healthy and happy. In today's video, we'll be talking about something all parents will face sooner or later: your baby catching a cold. It's a stressful time for parents, but with the right knowledge, you can confidently care for your child during these moments. 2. Why do babies catch colds? Babies often catch colds because their immune systems are still developing. In their first year alone, it's common for babies to catch 8 or more colds. This is especially true if your child is in daycare or has siblings bringing home germs from school. Colds are caused by viruses, over 100 different kinds, that spread through the air when someone coughs or sneezes. They also linger on surfaces like toys or tables, and when babies touch these and then put their hands in their mouths, the virus has an easy way in. 3. Recognizing the symptoms. The symptoms of a cold in babies usually show up 1 to 3 days after being infected. You may notice signs like a stuffy or runny nose, which may start clear and then turn yellow or green. Sneezing, coughing, fussiness, fatigue, or a loss of appetite. Difficulty sleeping and, in some cases, a mild fever. Some babies may even experience vomiting or diarrhea. Most of these symptoms should improve within 7 to 10 days, but in the meantime, it's important to keep your baby comfortable. 4. Treatment options for your baby's cold. Colds typically don't require medication, and since they're caused by viruses, antibiotics won't help. It's tempting to reach for over-the-counter cold medicines, but these aren't recommended for babies and young children under 4 years old due to potential side effects. Instead, focus on supportive care, rest, encourage your baby to rest as much as possible. Hydration, offer extra fluids, such as breast milk, formula, or for babies over 6 months, water or Pedialyte to prevent dehydration. Saline spray and suction, use a saline spray to loosen mucus and a suction bulb to clear your baby's nasal passages. Humidifier, a cool mist humidifier can help by adding moisture to the air, preventing your baby's nasal passages from drying out. If your child is over 6 months old and seems uncomfortable due to fever, you can give acetaminophen or ibuprofen. Just make sure to follow the proper dosage guidelines based on their age and weight. 5. Home remedies that help. There are also several home remedies that can provide relief. A warm bath or sitting in a steam-filled bathroom can soothe your baby's congestion and cough. If your child is coughing with a barky sound, like in cases of croup, exposure to cool air might help ease the symptoms. 6. When to call the doctor. Even though colds are usually harmless, it's important to know when to call the doctor. If your baby is under 3 months and has cold symptoms, or if they have a fever, you should contact your pediatrician right away. For older babies, it's a good idea to call the doctor if they have a fever of 102 degrees Fahrenheit or higher. They show signs of difficulty breathing, aren't eating or drinking, or have fewer wet diapers than usual. They seem unusually sleepy or irritable. If symptoms don't improve after a week or if they worsen, it's best to seek medical advice to rule out more serious conditions like pneumonia or an ear infection. 7. Preventing colds in babies. Prevention is always better than cure, and while you can't stop every cold from happening, you can take steps to reduce your baby's risk. Make sure to wash your hands often and ask anyone who holds your baby to do the same. Clean your baby's toys regularly and avoid sharing cups or utensils. Keep your baby away from anyone who is sick or large crowds during cold season. Don't let anyone smoke around your baby, as exposure to smoke increases their chances of getting sick. 8. Final tips and outro. We know it can be hard to see your baby sick, but by knowing what to expect and how to help, you can get through these colds with confidence. Thank you for watching Healthy Care. Be sure to subscribe to our channel for more helpful tips on keeping your little one healthy and happy. And remember, if you ever have concerns about your baby's health, it's always better to reach out to your pediatrician.